Good day, I'm Brix Pelayo from BSN1M7A. So today, I will demonstrate how to safely transfer a patient from bed to chair and chair to bed. This procedure helps improve circulation, prevent bed sores, and promote independence. It ensures both patient and caregiver safety through proper assessment, body mechanics, and use of assistive devices like a gait belt. So for the step 1, review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned. Assess for tubes, IV lines, incisions, or equipment that may alter the positioning procedure. Next is identify any movement limitations. Then next is gather all the materials including the chair and gait belt. Then for the step 3 is perform hand hygiene and put on PPE as indicated. Then next, identify the patient and explain the procedure. So good morning ma'am, I'm Brix Pelayo, your nurse for today. May I confirm your full name po?
Cassandra Faith Pikachu,
Your birth date?
August 25, 2006.
Can I check your wristband po? Okay. So today, ma'am, I'll be assisting you in moving from the bed to a chair so you can sit upright for comfort and circulation. This will also help reduce the risk of complications from staying in bed too long, such as bed sores or lung congestion. I'll be with you throughout the process and I'll explain each step as we go. Is that okay with you po?
Yes.
Then next is provide privacy for the patient. Since we're already in a private room and the door is closed, so we have full privacy for this procedure. Then next is lower the bed to the lowest position and raise the head of the bed to a sitting position or as high as the patient can tolerate and ensure the bed breaks. Then next is place the chair next to the bed. Then next, encourage the patient to use a stand assist aid if available. Alternate for that, I will assist her to move toward the side of the bed and into a side-lying position facing the chair. So ma'am, I will help you move toward the side of the bed. So please turn slowly to your side facing me. Then next, lower the side rail if necessary and stand near the patient's hips with your legs shoulder width apart and one foot slightly in front of the other. Next is encourage the patient to use the stand assist device as you assist them in sitting up on the edge of the bed, if available. However, in this situation, the stand assist device is not available. I will guide her legs over the side while I pivot on the back to leg, lift their trunk and shoulders, keeping my back straight. So now ma'am, I will help you sit on the edge of the bed. Please swing your legs over the side while support your back and shoulders. So ma'am, please hold on my arms on the count of 3. We will sit up together, okay? 1, 2, 3. Then next, stand in front of the patient and assist for any balance or problems or dizziness, allowing their legs to dangle for a few minutes before proceeding. So ma'am, are you feeling dizzy or lightheaded po?
No.
Let's sit here for a minute and allow your body to adjust. Then after that is assist the patient in wearing non-skid footwear to reduce the risk of falling. So ma'am, please lower your hands because I will now assist you with your non-skid footwear to prevent slipping. Then next, secure a gait belt around the patient's waist according to assessed need and facility policy. Then after that, stand facing the patient with your feet shoulder width apart and your hips and knees flexed to maintain stability. Then next is ask the patient to slide forward on the bed until their feet touch the floor. And position yourself as close as possible to the patient with your foot placed outside theirs for support. Then next is using the gait belt, assist the patient to stand by rocking back and forth and counting to 3. Then lifting with your legs on the count of 3 while bracing your front knee against the patient's weak leg if indicated. So now ma'am, on the count of 3, I will assist you to stand, okay? Ready? 1, 2, 3. I am supporting you with the gait belt and bracing your weak leg if any. Then next, assess the patient's balance and leg strength, and if the patient appears weak or unsteady, return them to bed for safety. So how do you feel now, ma'am? Are you steady on your feet po?
Yes.
Your balance seems stable naman po. Then after that, pivot on your back foot to help the patient turn until they can feel the chair against the back of their legs. Then after that, ask the patient to place one arm on the armrest if necessary for support while slowly lowering themselves into a seated position as you continue to brace their knees and support them with the gait belt, keeping your hips and knees flexed. So, can you reach the armrest. Okay, 1, 2, 3. Then after that, assess the patient's posture and alignment once seated in the chair. Then remove the gait belt if desired or leave it in a place if the patient will return to bed soon. So ma'am, are you comfortable naman po sa position nyo?
Yes.
Then I will now assess your posture and remove the gait belt po. After that, cover the patient with a blanket if needed. Then pull the side table closer. So ma'am, here's your food. Just press the call bell once you're done so I can help you transfer from the chair back to the bed. Enjoy your food po and thank you. Then after that, perform hand hygiene.
Three, two.
Now, I'll be performing a return demonstration for transferring patient from chair to bed. So for step 1, perform hand hygiene and wear PPE as needed. And after that, prepare the environment by removing obstacles and ensuring privacy. Then next, position the bed to its lowest height, ensure the brakes are locked, and slightly raise the head of the bed. However, in some instances, the bed is fixed and cannot be adjustable. Then next, apply a gait belt securely around the patient's waist. So ma'am, I'm now placing the gait belt around your waist to help support you safely while standing and walking toward the bed. Then next, assist the patient to stand from the chair using proper body mechanics. So now ma'am, I will help you to stand. Please place your hands on the armrest. After that, please hold my arm on the count of 3. We will stand together, okay? 1, 2, 3. Then next, assess the patient for balance or dizziness. So ma'am, are you feeling dizzy or lightheaded po? We'll wait a few minutes before moving just to make sure you're stable. Then next, pivot the patient toward the bed until the backs of their legs touch the edge of the bed. So now, let's turn slowly toward the bed po, and I will assist you until the back of your legs are touching the bed. Okay? Then after that, assist the patient to sit on the bed and remove the gait belt. So, sit na po. Then next, help the patient swing their legs onto the bed and lie down. And after that, adjust the bed for comfort and safety. Ensure call bell and needed items are within the reach. So ma'am, are you in comfortable position po ba?
Yes.
And after that, perform hand hygiene. Then last, ensure the patient is safe and comfortable. So ma'am, you are now safely in bed. I will continue to monitor you. Please don't hesitate to call if you need anything. Thank you for your cooperation po.